In 2017, a study was done on metformin, the most commonly prescribed medication for type 2 diabetes. The study showed that the blood glucose controlling effect of metformin is achieved through modulation of the gut microbiota. Type 2 diabetes is an impairment in the way the body regulates and uses glucose or sugar as fuel. This long-term chronic condition results in too much sugar circulating in the bloodstream. Eventually, high blood sugar levels can lead to disorders of the circulatory, nervous, and immune systems. In type 2 diabetes, there are primarily two interrelated problems at work. Your pancreas does not produce enough insulin, a hormone that regulates the movement of sugar into your cells, and the cells respond poorly to insulin and take in less sugar. Signs and symptoms of type 2 diabetes often develop slowly. When signs and symptoms are present, they may include increased thirst, frequent urination, increased hunger, unintended weight loss, fatigue, blurred vision, slow healing sores, frequent infection, numbness or tingling in the hands or feet, and areas of darkened skin, usually in the armpits and neck. Type 2 diabetes used to be known as adult-onset diabetes and is more common in older adults, but the increase in the number of children with obesity has led to more cases of type 2 diabetes in younger people. Some additional risk factors include weight, inactivity, family history, race or ethnicity, women who had gestational diabetes, polycystic ovarian syndrome, high blood pressure, and cholesterol levels. There is no cure for type 2 diabetes, but losing weight, eating well, and exercising can help you manage the disease. If diet and exercise are not enough to manage your blood sugar, you may also need diabetic medications or insulin therapy. It is generally believed that metformin reduces blood sugar levels by inhibiting production of glucose by the liver, upregulating peripheral glucose uptake in both the liver and skeletal muscle, and improving insulin sensitivity. However, it appears to work just as well in people with genetic variations that prevent it from reaching the liver. In the slow-release form of the drug, only small amounts of it reach the liver, so it would seem that these mechanisms form only part of the picture. In a double-blind study, the microbiome of 22 patients was sequenced before and after treatment with metformin for 4 months and compared with a placebo group of patients. The research showed that metformin increased the growth of several bacteria species that are linked to improved metabolism. Fecal samples obtained before and after the 4-month treatment period from metformin-treated donors were transferred to germ-free mice. The mice that received metformin-altered microbiota showed improved glucose tolerance. This shows that the metformin-modified microbiota may at least partially explain the good effects of metformin on blood glucose control. In particular, the drug seemed to encourage the growth of strains of bacteria called Akkermansia and Bifidobacterium, which can influence blood sugar levels. How the bacteria are doing this is still unclear. However, it is known that the composition of the gut microbiota is significantly associated with obesity and type 2 diabetes, as well as many other diseases. About a quarter of patients on metformin have metformin-associated gastrointestinal side effects, and some of these patients cannot tolerate metformin at all due to lactic acidosis. These researchers are hopeful that the people with diabetes may achieve positive effects by modifying their diets to change the composition of their gut bacteria by encouraging the growth of Akkermansia and Bifidobacterium, and that the adverse effects of metformin can be reduced by changing the gut microbiota of these patients. More research needs to be done for a longer period of time and on a larger sample size, but this is a promising outlook for those patients with diabetes who use metformin.